This morning, we have been in this pandemic for nearly a year, but I've got some good news. The number of people fully vaccinated in the U.S. is higher than the number of known COVID cases since it started spreading here. My next guest has been battling the virus on the front line since the very beginning. And here's how she described her patients when she first joined us last year.
They are absolutely alone. It's heartbreaking as a nurse to know that you are that person's everything. And sometimes in their last moments, the weight of trying to fill the shoes of the people who can't be there is really heavy.
I want to bring in a hero of mine throughout this last year, Maureen Grisius. She's a nurse at Beaumont Hospital in Fairmont Hills, Michigan. Maureen, it is good to see you. Good to see you on a positive day. Back then, you and I were talking a lot about people dying without their loved ones. You were the last person near them, and you could barely be near some of your patients. Right now, there's only a handful of patients in the hospital, and visitors are allowed in again. What's it like? How relieved are you?
Hi, Stephanie. It's good to be back. I can't believe it's been a year. I would say the hospital right now feels probably the most normal it has felt in a very long time. It is so exciting to see families in our halls and at bedside. It's such a relief to be able to include them in care of their loved one and in just that whole process from ER to when they get to go home.
But the struggle is far from over. You used to work in the ICU, but now you're in the inpatient rehab wing to help people to get strong enough after they go through COVID. You know, there's still a lot of people out there who say COVID, it's like the flu. It's far from the flu. Can you help us understand the challenges your COVID patients are facing?
Sure. I think that, inpatient rehab is a really amazing place to help people overcoming all kinds of debility. COVID is one of those that we have seen newly over the last year. And those patients really, by the time they get to us and are headed home, are facing a lot of issues that they didn't have before. They're very weak. Sometimes there are a lot of lingering respiratory issues, cardiac issues, and inflammatory issues that take a long time to subside. So people are still needing a lot of help to get stronger and to reacclimate to life and be able to be successful going home.
Is that just older patients or younger patients too?
I think that it varies. I think one of the most baffling things that we've seen with COVID is that it affects people so differently. Regardless of age, there are definitely risk factors, and there are definitely people who tend to do better and people who tend to get hit harder. But I don't think that that's an all-inclusive or definitive disease process. I think COVID keeps us guessing, and we have patients, young and old, who can have residual side effects afterwards. Absolutely.
I have to tell you, I have 2 vaccinated parents. I'm very excited about the new CDC guidelines, allowing people to see their parents, their grandparents. How are you personally approaching these changes? I know you've got 3 young kids and family around.
It's super exciting. My dad is vaccinated. Both my mom and my mother-in-law go to get vaccinated today. My other-in-laws are getting vaccinated. I know, their first dose this Friday, and it's super exciting. I think the relief that comes with that is palpable. And I think that no matter who I talk to, when their loved ones, when they know that they're on the other side of those vaccinations, it's an amazing amount of relief, a little bit of freedom, and that's exciting.
This has been an enormous undertaking for you. When you're on the front lines, it means your kids are too. What you've been through in the last year, would you do it again? And are you optimistic about the future?
So that's a question I feel like I've gotten kind of a lot recently. And I absolutely wholeheartedly would say that I don't regret not one part of this past year. I think nursing as a profession is so amazing at baseline. But I think that over the course of this pandemic, they have really shown they delivered extraordinary care in the most challenging of circumstances, and to be able to walk through that with some of the most intelligent and compassionate human beings on the planet, I would do it over and over again in a heartbeat. And to be able to minister to people and be at their bedsides when they needed somebody, again, I think I can stand with all of my colleagues and say, this is what we're here for, and we would all do it again.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank all of you out there.
Thank you as always.
Thanks to at home.
Thanks for watching.
Thank you so much for letting us into your homes during these extraordinary times.